Hello, everyone. Welcome to the 20th session of ISSUP Nigerian chapter webinar, the very first in the year 2024. So Happy New Year to you all.
Okay.
Agwogie. Ejikeme M is the head of the editorial and webinar team of ISSUP Nigeria chapter. As I call on Ejikeme to introduce the speaker. Ejikeme, over to you, please.
Okay, thank you so much, Dr. Martins, and welcome everyone to the first webinar of the year for ISSUP Nigeria chapter. Our speaker today is Dr. Chinyere C. Okonkwo. Dr. Okonkwo holds a PhD in clinical psychology, and she is a licensed clinical psychologist. Through the Fulbright Scholarship Award, she did her fellowship program at Hubert Humphrey Fellowship at Virginia Commonwealth University, Richmond, Virginia, in the United States of America. Her program was on substance abuse, education, prevention, and treatment. In addition to her training in substance abuse management, she was exposed to various psychological treatment modalities, as well as trauma and disaster management, crisis intervention, motivational intervention, and etc. She is also an international certified addiction professional, ICAP 1 and 2, and a United Nations Office on Drugs and Crime, UNODC Global Trainer on Drug Demand Reduction. Dr. Okonkwo has, over the years, garnered 20 years of experience in clinical experience and has served in different capacities. She was a member of the National Psychosocial Team for the management of the Ebola crisis and COVID-19 pandemic. She has also been involved in providing psychological first aid in various crisis situations within and outside the state. Presently, she works as an Assistant Director of Clinical Psychological Services and the Coordinator of Psychological Intervention for substance use disorder patients at the Federal Neuropsychiatric Hospital, Yaba, Lagos State, in Nigeria. She is the focal point for training on UNODC project in the hospital. She is actively involved in community enlightenment programs on psychological and mental health activities. She is a member of many professional associations, including the International Society of Substance Use Prevention and Treatment Professional, ISSUP. Dr. Okonkwo, it's our pleasure to have you today on the webinar. You can go on. Hello, Dr. Chinyere. Please, over to you.
Okay, good afternoon, everyone. I hope I'm audible.
Yes, you are. Thank you.
Can someone hear me? Let me just hear a sound to confirm.
Yes, please.
Okay, thank you very much.
Thank
So,
you.
Happy New Year to everyone once again, and I hope we're going to have a very beautiful time within this 1 hour. So, as stated earlier already, we will be talking about brief intervention for substance abuse, focusing on assist model. Assist model here because we are going to be drawing our illustrations from the assist screening instrument. So in the course of this presentation, we'll go through this outline, and I hope it will be quite engaging. So assist, like many of us already know, it's an acronym that stands for Alcohol, Smoking, and Substance Involvement Screening Test. It's a questionnaire, it's a screening questionnaire for people who have substance use issues. And it was developed by WHO, basically for patients seen in primary care settings. It's actually interviewer administered. Provides information on an individual's hazardous, harmful, or dependent use of substance, including the injecting drug use. So brief intervention is actually described as a low intensity, short duration counseling. So it can be as brief as 3 minutes, as brief as 5 minutes, you know. So it's something like the minimum that can be given to anyone, but very impactful, you know. So it uses basic therapeutic tools like empathy, the issue of unconditional positive regards, use non-judgmental approach, and all that. And it incorporates stages of change. As we progress, we're going to find out how these things apply. It includes feedback and advice. So the BI focuses on increasing a person's insight and awareness on substance use and the behavioral changes associated with it. As we all know, every form of substance use behavior introduces behavioral change. And through the use of BI, a lot of individuals have been able to identify the ways their substance use has influenced or changed their behaviors. So it also provides an avenue for people to understand the relationship between the habits, that's the substance, and some of the changes they observe even within themselves. So BI can be provided in a singular session, only one session can do, but sometimes it could involve multiple sessions, you know, beyond one. It can be 2, 3, or even more as the case may be. Like I mentioned, we will see that it involves other a lot of other techniques like the motivational interventions. It uses that a lot, you know, and the SUD professional, that's substance use disorder professionals, are able to apply some of these techniques in the process of brief intervention. So far, a number of studies done in primary care settings have shown that it's actually beneficial. It is useful. We know that primary care centers are places where general medical illnesses and all that are treated, not specifically substance treatment institutes. So, but when applied in such settings, it's been found that a number of people with substance use problems also get helped. So it gives the use of BI in primary care settings gives individuals who may not have been able to access care in specialized substance use treatment centers opportunity to get treated or to get attention. So why do we use BI? What's the rationale? You know, we know that substance abuse is associated with a lot of issues. There are numerous consequences. You know, a lot of people develop disorders. Some people have conditions that actually even can lead to death. BI, especially as when applied in such kind of settings, gives opportunity for early identification of problems enables the individual to know that he is tilting towards having problematic substance use. Or even for those who have started, gives them opportunity to start to reduce, helps in reduction of substance use consumption, or substance consumption rather. Also, for those who might have had real issues with it, it gives them opportunity to go into treatment and access care before it becomes too late. So it's actually a way of trying to nip the problem, before it escalates. Who can administer this? Myriad of workers can do that. Not necessarily specific professionals, but as you can see from the list here, we have up to 9 or even more. Basically, these are the people that can provide this care. People in the primary care setting, like the physicians, we have the psychologists, we have the medical personnel, we have people who are also working in the substance abuse treatment centers, emergency staff, social workers, mental health workers, and the likes. Now, linking screening with the screening score with appropriate intervention. This is where the BI is linked with the ASSIST. Now, in the ASSIST score, we have 3 levels. And as stated here, we can see an individual will maybe have be at low risk, or moderate risk, or high risk on any of the substances. Each substance is scored individually, as in it's mutually exclusive. The scores are mutually exclusive. So then, depending on the level of risk identified, the intervention is given. Now, as we can see from the first box, the low risk, what is required there is feedback. That is, explaining the results, the outcome of the screening to the
Hello, doctor. Hello, Dr. Okonkwo, can you hear me? Hello, Dr. Okonkwo, can you hear me? Ejikeme, can you confirm if you can hear Dr. Okonkwo?
No, I cannot hear her.
Okay, it's possible we lost connection with her.
Each substance is scored on 3 levels: the low, moderate, and high.
Hello, Dr. Okonkwo, sorry to interrupt you. Yeah, we lost contact. Yes, we lost connection with you briefly. Can you go to the 2 previous slides, if you don't mind?
Okay, here.
Good, thank you. Yes, please, thank you.
Okay, sorry about that. I didn't realize that. Okay, so I just mentioned that a good number of personnel can administer BI, provided they have the training. And I just gave a list of these personnel: physicians in primary care centers, psychologists, medical personnel, substance abuse treatment clinicians, and the rest of them on this list. And like in recent years, since we started this ISSUP journey, a good number of ISSUP members are not necessarily people that have medical background. Many people who have genuine interest in fighting against substance abuse have also tried to learn and to provide different intervention at different levels for people with this challenge. So in giving BI, it does not require any special training as in terms of qualification, like you must be a medical person. No, it doesn't have to be so, but you must have that interest, and then the basic training as well. Okay. So, and then I moved on to say that this particular slide talks about linking the result of the assist to the BI, to the appropriate intervention to be given to the individual. Now, I said that the result can be either at low level, moderate level of risk, or even high risk. And depending on where an individual is on a particular substance, then that determines the level of intervention. And I said for low risk, any substance that an individual scores low risk on, what he will be getting will be feedback, which has to do with the meaning of the result, and then some information about his substance use. Where the person's score is at moderate risk, the individual will get feedback and the brief intervention. Now, from this slide, we can see that brief intervention actually starts from when somebody achieves a score that is from moderate risk upwards. Then if the person's score is high risk, then you provide feedback, the brief intervention, and then referral, which is very important. And so on this slide, this is the patient feedback form from ISSUP, the ISSUP screening tool. And I said each substance is scored individually. And as you can see, if you can see my cursor, I'm just using this as an example. You see the low risk, the moderate risk, the high risk. So if anybody scores between 0 to 3, that puts the person at low risk for that particular substance. If it is within 4 to 26, that's moderate risk, but anything 27 and above places the individual at high risk for that particular substance. And as you explain the meaning of this low risk, moderate risk, and high risk, you look down here. This is already given. It simply means that if somebody scores 0 to 3 on tobacco product, for example, it means that the person is at low risk of health and other problems from his current use of tobacco. That is what it means. If the person scores like moderate risk for maybe inhalants, for example, it means that he is at risk of health and other problems from his current use of inhalants. So, and then for high risk, it means that the person is at high risk or already experiencing some problems associated with his use of a particular substance. He would have been dependent on that particular substance. So this particular feedback form helps to explain the meaning of the result. This is the feedback proper. This page is what you will use to give the person information as to where he stands in his use of a particular substance, whether he should start working on it to make sure that he reduces use or even stop, or he should watch it so that he does not go beyond where he is. And so these are the components of brief intervention. This slide, I can simply describe it as a toolbox. Every technician has his toolbox. A surgeon has his own equipment box. So you that is going to do BI, this is your toolbox. And what it means is every part of each of these components is what you must have before you embark on BI. And the acronym FRAMES has been used to describe what you require as an individual to be able to administer BI. So we're going to be looking at each of them as the slides roll. So we have the feedback, we have the responsibility for change, we have advice to change, we have menu of alternatives, we have empathy, style, and self-efficacy. So we'll look at the first one, feedback. Now, I had mentioned feedback and I showed you that feedback form. This simply means explaining the outcome of the result of the screening, the outcome of the screening, what that individual responded to, those responses he gave, what did it mean? Summarizing it, like everywhere you go to a laboratory for tests, after the test, you will request to see the result. They will tell you, okay, this is what is happening to you. This is what we call feedback. So in this feedback, the individual is given information about his drug use, whether there's problem there already or not. It also shows the personal risk associated with current drug use pattern. It's what you as the counselor or the clinician will use to explain whether the individual has any risk associated with his current use or not. So we are just moving to the next one now. Okay. So I was saying that after giving the feedback, after explaining the result, of the screening, the next is placing the responsibility on the individual. Now, a lot of people who have substance use problem, they kind of, most times, it is difficult for them to know that they can be responsible, they can have a choice, they can actually take a decision about their condition. It is difficult for them to see people believing that they can make a good choice, and so most times you see them taking orders. People tell them what to do and they do it. So at this point, giving them the responsibility is like telling them that, okay, so I have given you the result. Okay, you now understand your level, what is going on with you. You have the right to take a decision to deal with it. You can choose, you can't be forced. It makes them to feel that they are in control. You can use a statement yourself. No one can decide for you. So you put it back on them, and most of the time it kind of gives them some level of reassurance. So this person actually think I can make a choice. Okay, so I am still, somebody can still think of me as being capable of taking a decision, because most of the time they think everybody writes them off. So, and besides, we all know that in drug treatment or in substance use disorder treatment, you cannot force treatment. That is why the motivational interventions are very, very important. You cannot force anybody, you encourage them and work with them to take that decision. So you place back the responsibility to that individual. And then the next is advice. Here, you provide clear advice. As you are providing this advice, you are using information, knowledge, on the harm associated with continued use. You are using clear information. You are like educating that individual, You know, if you continue to, if you use beyond this level that you are, this is the likely thing that could happen to individuals who have done that. These are the associated issues that could come up. Okay, so you may also encourage the person by saying that if he starts to cut down or even try to stop, you know, he may limit his chances of experiencing those complications, you know. So you encourage by giving the advice. The advice this time is loaded with information, impacting knowledge on this individual, so that he understands clearly and know that even though you are not saying do this or do that, the information is very clear. You know, he knows that when he uses beyond what he is using, he's getting into trouble. And he knows that if he doesn't start to cut down on what he is using at the moment, he may likely develop problems. Then menu of alternatives. Now you offer options. Here you provide the patient or the client with a range of alternative strategies to cut down or stop. You know, you can make suggestions. You know, you could, if you were using like a pack a day, why not start to use, let's count in hours. How many sticks in the number of hours you smoke within the day? Let's count and then start to reduce. So you give tips on what he can do. You can also say, why don't you think about those things that make you to use, you know, those triggers around you. Let's start working around them. You can also make suggestions. Okay. Identify the situations that make that person to use most times. So encourage the person to deal with those situations and all that, just as a way of helping him to stop or to cut down use. Okay. This can encourage the patient to seek change. If he knows that there are alternatives, there are possible ways that it can be done, and he will be free or he will be better, he will want to try, you know, because the problem is most of the time when a person is using, what you get to hear people say is just stop. Once you stop it, that is all. Now, for somebody who is using to cope with a particular situation, if you are not able to help him to see the link between his trying to cope with a situation and his use of substance, it may be difficult for him to just stop. So if you offer him suggestions on way out, he may want to try it, and that could lead to the change that you're looking for. Empathic style. Like I mentioned, the use of BI includes the making use of warm, reflective approach. In every therapeutic or counseling relationship, there are basic skills that are very fundamental, that are very important. For example, listening skill is very important. Showing the individual that you are with him, that you are paying attention, that you are following, being empathetic to that person is very important. It encourages them to know that somebody is actually showing concern to their needs. And so you can do that by use of maybe simple reflections, like if a client or patient speaks and then you kind of reframe it so that he knows that you are following, you are not absent-minded, you are concerned, you know. Or you can even use, most times, double-side reflection, you know, to help the person to look at the two sides of the coin, you know, and see, because most of the time what they look at are those the gains they get from using the substance, the reason they have to continue to use. But when you have them look at the two sides of the coin, for instance, they also consider those things that are not so good about it, and they want to make a decision. Those are some of the motivational tips that come in, you know. So that's part of the tool. In other words, you know, for you to deliver BI efficiently, you must have knowledge of stages of change and motivational intervention. Those things are they are the basic things that are required. Now, self-efficacy. Here, the patient is encouraged to believe that he has the ability to change. I can do it. you help this person to elicit self-confidence statement. You know, I can do it. You know, if I was not using before and I was functioning well until a certain time, that means that I can still be the same person. You know, so you encourage that individual to rediscover the him that was before the substance. So you encourage that individual. And so what precisely, when you have gathered all these tools, as I mentioned, and it's time to deliver, what exactly will you be doing? So we'll look at the steps that you will take in brief intervention. It is actually brief. These first few points that I will mention can last for like 5 minutes, depending on the kind of client or patient before you. You know, sometimes it ends there, but sometimes depending on the level now, whether moderate or high risk, then you may want to go further. So the first thing you will do when you want to deliver brief intervention is to seek to ask the client if he or she is interested in seeing or knowing the result of the screening. Most of the time, people will want to know. Rarely will you find somebody that I don't care, I don't want to know. But you know, in our environment here, for instance, in Nigeria, where somebody does a test, he's eager to find out whether he knows or he already has an idea of what the outcome will be or not. He will still want to know. So majority of the time, the persons that do tests will want to know, but you have to seek their permission to discuss that result to them. So the first thing you'll do is to ask if they are interested in knowing the score. And so when the response is positive, you will now move to the next one. This next one is the feedback proper, providing the feedback. By this time, it is assumed that you already have the result in your hand with the scores of the patient. And so each one you talk about is substance that is significant, that is any of the substance that the individual has used, you can discuss the result of that substance individually. For the ones that show some level of concern, maybe moderate risk or even the low risk, you can give advice how not to exceed, how not to move beyond the low risk level, you know, how to maintain it, or if it were above that, how not to exceed, how not to continue to get worse in the use of specific substance. So you will also talk about how he can reduce his use and the risk that could be associated with continued use. And you will also encourage the person by helping him to understand that certain kind of complications can come if he continues the way he was using. That is the feedback and the advice that you give that is associated to it. And remember, you are not just talking freehand, you are talking with the result in your hand. So it is evidence. It's like saying evidence-based result is there. What he has responded is what we are sharing. Now, by the time you do that, you will now allow the client to take responsibility. So at this point, you can say, so the information I have provided for you, you know, you already know. What you do with it from this point is utterly your decision, you know. If you decide to work on this, then we can work on it together. I'll be here to support you. You know. So you have pushed the responsibility to the patient. You will also go, the next one is you ask the client how concerned they are about the result, whether they are concerned about it, how concerned, you know. For some people, they may tell you that, oh, they didn't know that if they move to this level, they could have issues. For some, they will say, no, I'm not bothered. I know I will not exceed. You know, different kind of responses, you know, could come up. So the next thing that you could ask again, or you can engage your client with in BI, is to encourage them. Here you make use of the motivational techniques. Encourage them to look at the pros and cons, the positive and the negative aspects. In this case, you're going to be specific and careful with the choice of words that you use. So you start with asking, what are some of the good things about your use of this particular substance? The substance, whichever substance showed significance in the result. You know, the person can list every good thing that it has done, and then you go to the flip side. What are some of the not so good things? Now, you are not saying what are some of the bad things, or what are some of the dangers or consequences, you know, or disadvantages. You are saying not so good. The choice of word here is very important because it helps the person to not to look at it as judgmental statement. What are some of the bad things, you know? So you talk about not so good. And here it also helps the patients to feel free to talk with you about some of the concerns, you know, that they have about the not so good things. You summarize. It can come in different forms. I'll give example. A patient may say, okay, oh, when I smoke or when I take alcohol, it makes me to feel so light. I'm able to socialize. I'm able to relate well with everybody. In fact, I feel good. It makes me feel really good. I say, oh, and you have a lot of friends that kind of thumbs up for you, you know, because you are in free spirit. Okay, that's good. On the other part, not so good. Oh, the not so good is that you see people get to complain. People in my house, my wife, each time that happens, we get to quarrel, and I don't like it. I don't feel good about that. Now, for you to summarize and bring the two realities close, first, he enjoys it. It gives him everything that he wants. And secondly, it brings conflict between him and his spouse, for example, and then he doesn't feel good about that either. So you can actually use this double-sided reflection. You know, so on one hand, it makes you to feel good and you feel you can socialize and people like you, but on the other hand, it brings about relationship problem with your spouse and you don't like it. So you place it side by side for this individual, and then you ask further. You know, you ask further. This time, ensure that you use open-ended questions because that is what will help you to elicit a lot of responses from the. You can go further to say, from what we have what is it that give you concern about the not so good, you know? So it's a way of opening up conversation with this individual. He will now start to tell you when I have issues with my wife, when we quarrel, and all the kind of things that could go wrong, you know. These things that we have talked about, does it give you concern? How? That's another way to put it, you know. So you allow this individual to express, and you see, as he is bringing out those points, those are the points that you're going to keep and use to keep encouraging him until he decides to actually choose between having a very good relationship and then still feeling good without using the substance. Now, at this point, you can provide materials or further or links. These days is links, you know, where the individual can read more about the substance, what people have been doing to help themselves cope with it, and what he can do to support himself as well. And then at the end of that, you will also make that statement that you are always available to support. Now, For somebody whose use is on moderate level, this is the end. But where a person's score is at high risk, you have to go a step further. And that is where we get to the referral. Now, making referral is what many of us are familiar with. Either that you have referred particular service or you have been referred. One way or the other, you would have experienced it. Now, in many settings, when people are referred to access particular care, it is not always as straightforward. I will speak based on my own environment here in Nigeria. You know, when somebody tells you, okay, what you need, the professional that can give you care is in so and so institution, you go there. Now, for people who use substance, most times they don't have the patience. They don't even think it's so important for them to go and suffer, because by the time you go to the agency, you will have to meet with a lot of hurdles, you know, before you can access care. So it becomes a problem. Therefore, mentioning of referral in this context becomes very important. Why? Because we need to know that in referring person, it is not just enough to say, okay, take this number and call this facility or call this person. No. You, as the person who is making the referral, will go a step further to make inquiries on behalf of this individual. Ask about the agency, ask about maybe the day of appointment, the things that are required, and every information the individual will need, including the route. How will the person get there? What time is best to go there? And then if you can, and we encourage people to always do this, if you can, send the person direct to somebody specifically. Don't say go to that department. Get a phone number, get a colleague's number. Send the person to go and meet that colleague direct. That way, the person feels that you are committed to help, and he feels even better knowing that he's going to meet a particular person to assist. And that is why most times when we are in training, ISSUP training, or any form of drug demand reduction training, we encourage networking. Where you network, you become aware of your colleagues at different parts of the country or the world. And so when you have any client that can access anyone, it becomes easy for you to quickly reach out to that colleague and say, please, I'm sending this person, do accord him the necessary assistance. It goes a long way to help the individual, you know, to cooperate with treatment. So referral is not about collecting number or giving direction. It's about helping the person to walk through the process as well. Okay, so there are other things that you will be mindful of in making a referral. Now, for you to make referral, depending on the issue at hand, you may need to release some information about the patient. Now, you have to be aware of the laws and regulations about communicating patient information. What exactly will you be, what particular information will you be releasing? Remember, before any engagement, you have talked about confidentiality, so you don't want to breach it. You want to be careful. So you will know about the law and ensure that you get written consent, even though most times the issue of written consent are not always there. You know, most times you get the oral consent, but written consent is encouraged so that in case of any litigation or anything, you will know that you are covered. Okay. It's also important to know about the law regarding minors, the minors, and then the informed minors. You know, what information will you be releasing? What information will you share with them, and all that? It's very important. Every society, every country have their own laws and regulations as regards these issues. And so you also encourage follow-up. As you make that referral, you are not just pushing the person off to go. You still leave the door open for the person to come back as a way of follow-up. And during that follow-up, what you need to do is to ask the person about the recovery journey. You know, has he used? What has been the challenge and all that? Review the goals and progress. Look at the person's progress. Is he really working according to what you would have discussed, or are there deviations here and there? Encourage the person to continue. You know, where the person has been doing well, commend. You know, if there are ways, if there are incentives that are available, you can actually offer. But if there are none, encourage the person to continue, and then continue to review the tips for progress. You know, if for example, what you had agreed with the person was that, oh, by the end of 1 month, he would have reduced his use, you know, from 1 packet to only 10 sticks. You know, you will review that to see whether he's actually meeting up. You know, that's what you talk about in follow up. So I would like to summarize in that BI, which for me I consider very interesting. They say it's low intensive. It has low intensity, yes, but very interesting and effective. You know, simply has to do with explaining the screening results, providing information on safe use or how not to use at all, providing advice for patients on how to change, assessing the patient's readiness to change, and working with this person, helping the person to develop discrepancy and to be able to take decision, you know, work on his motivation to be able to take decision to change, and provide strategies for change, arrange for follow-up as well. Okay, so on this note, I will also say that, in fact, almost everything I have said you can get from these links here. I will encourage us to read more, you know, to read more and get more information about BI. A lot of people have used it. It has helped good number of people who need our help in order to curtail their substance use. Thank you very much.
Thank you so much, Dr. Okonkwo, for the excellent presentation. Time will not permit me to summarize some of the takeaways from the presentation, but the second to the last slide also did that beautifully. So I need not add to what you have already summarized. I must say thank you so much for this presentation, and I want to believe that the attendees have benefited immensely from your wealth of experience. Let me call on Ejikeme now. Let's see how many questions we can take before we wrap up. Ejikeme, please go through the question sessions. I can also see that most of the comment there are words of commendation to the speaker, not much of questions. So please still go through there and see whether we have a specific question that the speaker will respond to. Thank you, Ejikeme.
Thank you so much, Dr. Martins, and thank you, Dr. Chinyere, for that excellent presentation. We are still expecting questions from participants, and just like Dr. Martins said, we have quite a good number of commendations and comments from participants. I think we have few questions already dropping in. The first one here is from Bernard Chukoma. And his question is, if someone is on risk level of 27 plus on the 10 substances shared in your slide, what is the possibility of the person coming down as low as 0 to 3?
Okay, so do you want me to respond one after the other?
Yeah.
Okay, so if somebody is on risk, now we know that when somebody
risk level of 27 plus.
Yes, when somebody is at that high risk, that is actually high risk, you know, there is a possibility, but the person will have to walk through. And for that, you will want to ask yourself first, do you have what it will take to deal with that person, you know, or will you need to give your brief intervention and make referral, ensure that that person is referred to access proper care? Because what it means that 27 plus means the person is dependent and is either having a problem already or at the verge of having one. So it's important that you don't just do the brief and expect that the person will start to reduce. The person will need to go into treatment. That's what it means. But you have to encourage that person. That's why you do your BI, so that the person sees the need to act quick.
Okay, thank you so much. We have another one coming from Isaiah Ogenero Agwogie, and he's asking specifically on referral. His question is, are the NGOs engaging people with SUDs easily accessible to Federal Neuropsychiatric Hospital for a successful drug demand reduction in Nigeria? I think what he's trying to ask is if there's any kind of partnership, any level of partnership between the Federal Neuropsychiatric Hospital and those NGOs who are working with people with SUDs.
Okay, so the Federal Neuropsychiatric Hospital, Yaba, is a public institution and offers services to everyone that comes, you know. So, and we also know that generally in Nigeria, every treatment is pay as you go. So whatever NGO or group that wants to have anything in terms of treatment with Federal Neuropsychiatric Hospital.
Hello, Dr. Chinyere. It looks like we lost her at this point, and it's almost time for us to, while we wait for her to, I think, Dr. Martins, if you have anything to add in the presentation, you can go ahead.
Okay, let us hope that Dr. Okonkwo will still be able to join us. Before then, let me quickly respond to the question about link between NGOs and the Federal Neuropsychiatric Hospitals. I think the speaker made reference to that clearly because ISSUP has provided that platform for everyone to network, irrespective of where you work and the organization and your even professional disciplines. So every professional discipline is recognized and accommodated within ISSUP. So whether one is working under an NGO and you have colleagues who work in these new Federal Neuropsychiatric Hospitals, it becomes easier to even reach out to them one-on-one, even before you do organizational referral from your NGO and the hospital. So that networking is very important. And again, I think the speaker made reference to it, even though it is expensive, the fact that you refer from NGO or from other sources, definitely patients are made to pay for their healthcare costs because there's no insurance coverage for persons with substance use disorders or for their treatment in Nigeria. The same it is in many countries of the world. So the thing is that beyond the referral, which of course the speaker made a very important point there, when it comes to referral is not just about sending the client or patient to a particular center, but there's also the need for follow-up. And that follow-up will rest so much on the network you are able to build. And that is where, again, the network or the platform that ISSUP provides becomes very important in building that working relationship even before you make a formal referral. But that is not to say that Federal Neuropsychiatric Hospitals or hospitals generally do reject patients or clients from NGOs, right? So with or without ISSUP now, for example, of course, referral need to follow the proper channel. I want to believe that there is that working relationship, at different levels, depends on who one is relating with. So on this note, let me check whether Dr. Okonkwo is back to us. Dr. Okonkwo, are you there? Wow. Okay, looks like you're back. Good. Ejikeme myself that we cannot see you now. Dr. Okonkwo, we can see you. Dr. Okonkwo, can you hear me? Dr. Okonkwo, can you hear me? Okay, it looks like we are having a network challenge from Dr. Okonkwo's end. And incidentally, we are actually out of time. Dr. Okonkwo, can you hear me now? Okay, the network still is not stable. Well.
Yeah, now. Hi. I can hear now.
Okay, good. We are already out of time. You may have one or two last words before we close. If you have something to say in landing on your last point, you can go ahead with it and conclude. Thank you.
Okay, well, I just, well, I was talking about the openness of the hospital, in accepting patients who need treatment, whether NGO, whether different groups, or even individual, the hospital is always open, to accept people who need care, provided there is enough space to accommodate such people. Sorry, the internet just got crazy the last minute. So I couldn't, I don't know. I know I've lost a lot of questions.
That is fine. I think you landed on that point. Once again, thank you so much for the brilliant presentation. I want to believe that the attendees will be eager to have you again very soon. Please, those who possibly will not be able to respond to their questions, feel free to reach out to us. Once you get the contact of any member of ISSUP in Nigeria, you can always reach out to us. You can reach out to the speaker that we can take up or continue with the discussion from there. I said thanks to all the attendees from different parts of the world. We appreciate the fact that you're always keeping track of ISSUP Nigerian chapter webinar. So we look forward to another session again in March, and I want to assure you it's going to be another learning experience. So on this note, I want to say thank you to ISSUP Global for always giving us this platform, to my colleague Ejikeme who moderated this session with me, and in short to everyone, thank you for joining us as we look forward to another session again. Bye for now. Thank you.